Hi, welcome. Christine Burney from CorporateProfile.com. Today we have an exciting guest, Robin Smith, CEO of NBS Neostem, traded on the Amex. Again, NBS is the ticker. You can look it up right now. And we're going to go ahead and interview Robin.
Hi.
Hello, Robin.
How are you? Thanks for having me.
Okay. Well, Robin, if you would like to just tell our viewers just a little bit about Neostem, a brief overview of the company.
Well, our company started with the ability to have a person, like you and me, have our stem cells collected, processed, and stored for future use. Now we're growing and expanding into other parts of the world, like China, giving us the ability to help move research forward and different therapies using different technologies that have been developed in the United States.
That's exciting. Very exciting. I know that stem cells, that's a very hot topic, especially with the new administration in office. Why are you so excited about stem cells? What really does it for you?
Well, you know, for years we've been using stem cells to treat cancers. You need a bone marrow transplant, you have stem cell therapy. But now there's over 2,200 clinical trials showing that stem cells can be used for other diseases to treat repair, for example, a heart attack, wounds, burns, are potentially useful in diabetes, MS, lupus, and other diseases. So it's a huge and exciting field, and new therapies I think will be down the pike that are stem cell based. So it's exciting. And you mentioned Obama and the new initiatives using embryonic stem cells. I think it's exciting. Research is clearly going to continue to advance therapies, but what's unique about Neostem is we're not embryonic. So it's adult stem cells, and we have a technology that says you and I have very small embryonic-like stem cells in our bodies. So it's stem cells in the adult that act like an embryonic stem cell, but it's not controversial.
You would just inject your own healthy stem cells.
Yeah, like anything else, as we age, we get older, and our cells get older as well, and you don't produce as many stem cells, and they're not quite as effective. So the earlier you can get them, the better. I think about it, when you go from New York to Chicago on an airplane, that's equivalent to one chest x-ray. So we get exposed to radiation, and that affects your body. And as you know, as we get older, you get changes, the free radicals that causes your DNA, and you get cancers. So the earlier you can get your stem cells collected and frozen in time, processed, you can use them for the future. That's the ideal.
Would you mind going over some potential applications for our
Sure.
viewers?
Well, for years in treating cancers, people would need a bone marrow transplant, and that was stem cells. So it's been the standard of care for leukemia, lymphoma, some multiple myelomas, and anemias.
Right. And you hear a lot about cancer treatment.
You hear a lot about it. But you know, there's over 2,200 clinical trials looking at using stem cells for diseases outside of cancer. And they've done a lot of trials with cardiac disease, MS, lupus, diabetes, wounds, just to name a few. So it's a growing area, and we're very excited about it. The DoD has given us a grant to look at wounds for the military, a way of treating wounds or burns that people get using stem cells.
So regenerating skin.
That's right, regenerates it.
Okay, so regenerating skin. That's very exciting. But how about cosmetically?
Yeah, well, you know, very many people are focused on cosmetics. Dr. Giampapa is a leader in the field, and, you know, his interest is using stem cells for dermatology. So imagine if you could, instead of getting Restylane and Botox, you could use a little bit of fat. They could even take it from their stomachs to make it flatter.
One-stop
and put
shop.
It in, right, exactly. So I think there are a lot of applications coming down the pike. You know, obviously, we have to be very careful, and clinical trials are done. So I think we'll continue to see advancements in treatments in the future.
Now, Robin, Neostem just closed on an above-market financing, which is very exciting for our viewers. Can you talk a little bit about that?
Sure. In this economic time, we feel we're very excited about this. And I think what's more important is the fact that there are investors out there who feel that our stock is undervalued and are willing to pay more for it. They couldn't get that quantity of stock in the public market as we have a tight float. So it's an exciting opportunity. It'll give us the ability to expand internationally, and push the research forward, as well as the therapies.
And this isn't your first above-market financing, correct?
No, actually, the last 5 financings have been above market, so we feel very lucky.
Very impressive. That's a very good reason to buy. So it's very undervalued right now. And anything else you would like to kind of tell our viewers about, you know, what the working capital or the funds are going towards, or, you know, your vision, anything like that?
Yeah, well, I think for us, you know, we're very focused on revenues. We feel that we'll be able to generate revenues overseas, and we have a lot of great things coming, so look out for announcements and some future news.
Wow. All right. Well, there you have it, viewers. Neostem, ticker NBS, traded on the Amex. I'm Christine Burney. Robin Smith, CEO. We're happy to have you. Thank you for coming by. Have a good day.
Thanks for the interest. If anyone would like more information, you're welcome to give us a call at 1-888-STEM-BANK or come to our website, www.neostem.com. And of course, you're always welcome to call me or email me at rsmith@neostem.com.